1 second. And we're going live on Facebook at the moment. Fantastic. We are now live. Thank you so much for everyone joining. This is being broadcast both to the webinar on Zoom as well as to the my personal Facebook page. So please feel free to share it, create a viewing party, whatever you like. I'm thrilled and very grateful, Tom, for you joining us. Tom Sugarman and I have been friends for almost 30 years. We met right after you finished your residency. And you have become a very prominent ER physician, and we're really grateful that you're joining us today. And this really was inspired by a talk that you gave to our entire company a couple of weeks ago about how to stay safe during the COVID pandemic. Welcome, and thank you, Dr. Tom Sugarman.
Thank you. Good morning, Olin. How are you doing? And I know this is a really tough crisis for everybody. I just saw the jobless report in addition to all the health reports, and it looks like about 6.5 million people lost their jobs just this week. How is your company and your clients doing?
Well, we wish we were doing this without the terrible human cost that's going on right now. More than 10 million people have filed for unemployment in the past 2 weeks. LeadCrunch is actually doing quite well. We're seeing a change to our business where there are larger orders from larger companies. We expect that the market for what we do, which is B2B demand generation, is going to change dramatically between now and the time of the end of this crisis. And newsflash is going to involve a lot more AI. We've actually released a tool called the COVID B2B Impact Score to help our community, help our customers better understand how COVID will impact their business. And if anyone's interested in that, please contact me. We're giving that away free. Anyone can use it. So so far, knock on wood, things are going pretty well for LeadCrunch. But again, we wish we were doing it in a more positive environment for everyone else.
Absolutely.
So I'm going to be terrible at introducing you, Dr. Sugarman. Can you please give us a little background on who you are and why you're here?
Sure. My name is Tom Sugarman, and I'm a board-certified emergency physician. I've been practicing for about 28 years after completing my residency at Harbor UCLA Medical Center in Los Angeles. And since that time, I practiced clinically in a variety of hospitals, mostly community hospitals. Currently, I'm located in Northern California in the San Francisco Bay Area. And I've also held some positions with medical societies. I was the past president of the California chapter of the American College of Emergency Physicians, and I'm also a past president of my local county medical society, the Alameda Contra Costa County Medical Society. And I'm here because I think one of the responsibilities of physicians is to, we're getting some feedback there. I'm here because I think one of the responsibilities of physicians is to try to educate and inform. Fortunately, right now in the San Francisco Bay Area, we are not currently overwhelmed with patients. So I actually have some non-clinical time available as compared to my colleagues in, say, New York, Louisiana, Detroit, and other areas where they're exceedingly busy. And what we're hoping is that by better educating and better informing people, people understand the gravity of the situation and really practice the socially distancing to try to decrease and flatten that curve that you've heard people talk about.
Well, that's great news. And so the reason you're not overwhelmed is why? Because of why is it better here than it is, say, in New York City?
Well, I think it's probably multifactorial. And the first thing people need to understand is that we don't know as much about this disease as we'd like to. This is a brand new disease that showed its ugly head in December. And so we're still learning a huge amount about it. And the information and data is conflicting, and oftentimes the information changes, sometimes day by day. Probably the reason that we currently in the Bay Area are a little bit better off is because some of it's luck. We probably didn't have as much spreading at one point. But probably more importantly is that our public health officials were very aggressive very early at implementing social distancing guidelines. And in fact, the 7 Bay Area counties were the first in the country to go to a very strict shelter-in-place methodology, and that happened on, I want to say, March 14th, Monday night. And in fact, they just tightened it up just a little bit 2 days ago to even make it more strict. And I think that's been the crucial difference. The state of California implemented shelter at home on March 19th, several days later, and New York did it, I believe, a day or two after that.
So, and Florida waited until yesterday to do it.
Yes.
Do you expect that other parts of the country will see the type of problems that New York's having because they waited so long? Is that something that we should be aware of?
I think that there's going to be hospitals overwhelmed in some localities, probably not across an entire state, or hopefully not across an entire state. But I think for sure we're going to see hospitals overwhelmed in certain localities, including in California, Florida, and other states. The data is ever evolving, and the modeling is pretty difficult for the modeling experts because we still don't understand the basics, all of the basics of the disease spread, and we still have very poor testing.
Why do we have such poor testing, or what? I mean, that's just stunning to hear that we're not. Korea tested and isolated. What's going on in the United States that we can't get our act together on this?
I think the two things that are most disappointing is that our country had a significant head start. We knew this was going to happen December, January, certainly in early February, and we did not really respond as well as we would have liked, as well as we could have. And so we never ramped up testing. And now, even though you hear a lot of press about that there's testing available, that's just not really true. In many places, including where I practice, there is not enough testing supplies. So although we could maybe get a lab to run the test, although there might be a delay in that, we can't actually get the swabs or the transport media to do the test as often as we would like to do.
So do we even know, are the numbers that we're seeing coming out of Johns Hopkins and the various data sources that are saying we have 250,000 people, is that just bullshit because we have no idea?
Well, I think it depends which numbers you're looking at. The numbers I'm trying to look at are the number of patients in ICU beds, because that we have actually some pretty good information on that, although different states, different localities report that differently. In terms of looking at the number of people who have tested positive, that is not very useful data, because we know that there are a ton of people out there who either had asymptomatic or minimal symptoms and never got tested. And so those people are not falling into the data set that's been reported when you look at positive test results.
So it sounds like we missed the opportunity to test and isolate. We missed the opportunity. You have not talked about contact tracing. It sounds like we're past that point as well.
So I'm not a public health expert. I think we certainly missed an opportunity early in February to do that. I think there's still some potential that if we could get testing ramped up, that in some areas where it's not incredibly widespread, that may still be effective, but it's certainly not going to be effective in huge population centers where the disease is widespread already.
So brings up an interesting point. Why are some people having almost no symptoms and other people are dying from this? I mean, it seems to be that testing should be able to tell us what is the course of the disease when someone gets it, right?
So the testing that we're talking about is right now a polymerase chain reaction, or PCR test, that detects viral RNA, usually in your nasopharynx, the back of your nose, but it could be in other areas of your body if you're tested that way. And that simply tells you if the virus is present in that person's body. The first thing is that testing is not incredibly sensitive. It may give a false negative as much as 30% of the time. And then secondly, like all viral diseases, some people are going to have variable symptoms. And in this particular disease, some people appear to have absolutely no symptoms. Some people have very minimal symptoms, and a few people get very, very sick from this.
And do we know why some people are getting very sick and some people are not? I saw an interview on CNN, and what's great about this, by the way, is please, audience, ask questions in the chat section. My understanding is that there's some early indications that we can test to determine how severely someone will get sick or not, based upon what I'm hearing on the news.
Well, you asked why some people get sick and why other people don't get sick. We don't have a good understanding of that. There's a bunch of theories out there. What we do know is that older people, particularly over the age of 50, and as you get older, that risk probably goes up, and people with underlying health conditions such as lung problems, asthma, emphysema, heart problems, heart failure, heart attacks, hypertension, diabetes, and problems with the immune system are at increased risk. And so, on the other hand, we also know is that there are some young people who are getting quite sick from this. Interestingly, many of the young people who are getting quite sick are getting sick from what we call cardiomyopathy, where the heart stops working as well because the virus is directly affecting the heart. But why one young person gets sick and another one doesn't, or why one older person with diabetes and asthma gets sick and another one doesn't, we don't have an understanding of that.
We just got a great question on our chat section from our chief scientist of our company. Does the viral load of exposure matter? Do we know strongly or strongly suspect that the amount of virus in the exposure leads to more severe illness?
So there's not really any data that I'm aware of on viral load, which is when you're exposed, how much virus do you actually get into your body. But if you look at other diseases and also some of the epidemiological studies associated with COVID, that's probably the case, that the higher the viral load you're exposed to, the more likely you are to get infected, and potentially the more likely you are to have a more serious illness. But that is still another unanswered question.
Interesting. So we've heard the social distancing. Is there anything else we can do to stay safe?
Well, I think that, social distancing is really crucial. And the main reason we're doing social distancing is first to prevent you and other people from getting ill. But the bigger issue is we have to slow down the progression of this disease, because the healthcare system only has a certain capacity. And while we're trying to greatly expand that capacity, we're not going to be able to expand it limitlessly. And so if we can have people get sick at a slower rate of speed, then we can take care of them, because a lot of people, particularly, for example, in Italy, may well have been able to be saved or have less disability afterwards if their medical resources had not been overwhelmed. And so we're really working very hard to prevent that from happening in the United States, and where it does happen, to mitigate and minimize how much that happens. So that's the main purpose of social distancing. The other thing you do is be really, really good about hand washing and trying to avoid any contamination. There was just an article out yesterday from Singapore in the CDC's Morbidity and Mortality Weekly Review, which described transmission in Singapore. And one of the concerning things there was that it looks like one case happened from a patient who went to a church and sat in the same seat as somebody who at the time was asymptomatic, had been several hours before. And so almost certainly, if you look at cases like that, that's from touching something, not washing your hands, and then somehow touching your mouth or your nose or your eye, and then you somehow ingest the virus.
Wow. So that actually ties really nicely into a question we just got from the audience of what about wearing masks? There's an assumption of mask availability for first responders and healthcare professionals. What about the rest of us?
So in the healthcare community, we talk about this as personal protective equipment, PPE. And of course, there's a terrible shortage of that, and that's making it more difficult for nurses, physicians, techs, everybody in healthcare to work, both because they're very worried about their own health, but also because since we see a high disease burden, but we also see people who would be at increased risk from a serious disease, we may expose them if we get infected. There's a lot of contradictory data about exactly whether this virus is what we call aerosolized or whether it's airborne or droplet. And I think that data will become more clear, but probably not for a while. That said, I think the idea that if you're going to have to go out and go shopping or be around other people, taking an action to put a mask over your face, even if it's a homemade mask, may stop droplets from coming in. But more importantly, if you happen to be an asymptomatic carrier, it will decrease the likelihood you could spread that to somebody else. The Center for Disease Control is not yet recommending that, although they're actively discussing making that recommendation.
So, I've had the experience in the past week or so where a couple of my friends, one woman was diagnosed with an aggressive form of breast cancer. Another friend of mine was diagnosed with bone cancer. I have several friends that are having families and pregnant women. Can you talk a little bit about the normal things that, I hate to say that cancer is normal, but unfortunately it is. And certainly pregnancy is normally one of those things we're very excited by and celebrate. Can you talk a little bit about what happens to these people that normally need health care during this thing? What happens to the risk of pregnant women, for instance?
Well, I think there's two parts to that. There's the risk to pregnant women, three parts probably. The risk to pregnant women of getting the virus, getting sick from the virus. And right now, it does not look like pregnant women are any more or less likely to get very ill from this or to actually even get infected. Then there's the risk to the unborn child. And that really there's no data about, or I'm not aware of any data. And that's because, if the disease started in December, people, it's only been a few months. And typically, if an infectious disease is going to cause problems during pregnancy, it's going to be during the early parts of pregnancy. So we haven't really seen any of those pregnancies come to completion yet. And then there's the risk to, what about pregnant women's ability to get health care for anything else? And that's been impacted. Clinics are closing down. The resources we're trying to conserve resources for what we expect in our area. And what we're already seeing in, for example, New York is a massive influx of patients. So it's much more difficult to get medical care for things like cancer or pregnancy or the things that we already have that are more common and more routine that are not part of this particular crisis. So that's another negative impact, is that we're limiting our ability to provide that medical care.
So social distancing, keeping ourselves safe, masks are a question mark. What about if we just go to the grocery store? Do we need to be vigilant about cleaning the packaging as we go through the store, which I've seen some people do? And talk to me about that.
Well, I think the biggest thing is when you go to a grocery store, which is a high touch area, everybody's touching the shelves, the packaging, the checker. And so the first thing you want to do is you want to be really good about not touching your face. And even now during this, you've seen I probably touched my face a couple of times. It's really human nature to touch your face,
right?
Which, by the way, may be another advantage of the mask because it reminds you not to touch your face. Even
I have an incredibly strong itch right now. I could be like, oh.
Yes. So even if it's a homemade mask, if it reminds you not to touch your face, that's probably got some value. So in terms of the packaging, there's been variable reports about how long this virus can remain viable on hard surfaces, soft surfaces. And so, it's not totally realistic to sterilize all of the things you bought. I can tell you what we're doing. I don't have a whole lot of science for this. At my house, we try to be careful to not bring that directly into the main living quarters or the kitchen. Stuff that's perishable, we try to wash it off as best we can. We wash our hands after we do that. Stuff that's not perishable, packages, I just let them sit for a couple days. And because we don't think that on a dry surface like cardboard, which is what most packages are made out of, we don't think the virus is viable for more than a day or so. So if you just let it sit for a couple days, then you should be good.
Wow. Great advice. What do we not know about the disease? It sounds like we've got a lot of knowns about distancing, keeping safe there, but what do we not know? In other words, do we know if the virus is mutating into a form that could be worse than what we've got now or less potent?
So we know that the virus is mutating because that's the natural course of the way the virus works. Right now, we don't think that it's mutated significantly enough so that it's going to change a huge different disease pattern, or more importantly, change the way our immune systems respond. And so that if we can develop a vaccine or a treatment, right now we think that would work in general for this virus, even with the small mutations. The likelihood of the virus having a significant mutation is pretty small, but of course it was a significant mutation that created this virus in the first place. There's millions of these viruses out there, and they're always having mutations, and it's pretty rare that we see an outbreak like this.
So there's a lot of discussions about potential treatments. Of course, there's a lot of fraud out there of people trying to sell magical cures. We've seen something, even one of our panelists asked about a study that Carnegie Mellon's doing about a voice test for COVID-19. I've not heard of that. How should people be looking at these type of quote unquote innovative tests and sorting out what's legitimate and what might not be legitimate?
I think you really have to look at, medical professionals and, the CDC, your local and state health departments, professional organizations. So the American Medical Association, the American College of Emergency Physicians, the California Medical Association, other specialties all have information and resources out there. And that information is pretty reliable. There are certainly already have been, orders issued by the government to stop what appears to be fraudulent or unproven treatments or testing.
Right.
The breath test, I've never heard about it until you just mentioned it. I wouldn't rely upon that.
It was a voice test, but
oh, sorry.
So is the advice that we're getting from medical professionals such as Dr. Fauci and so forth, how good is that? Is this something where the mainstream media is providing accurate or inaccurate information? How should we be looking at that?
I think Fauci's doing a really excellent job. Dr. Fauci's doing a really excellent job given some of his constraints. I think in general, most of the media is trying to do a really good job. But of course, if they're provided bad information or the information changes, then the story changes. And so we have to go back to the fact that we still don't understand a lot about this virus. We still don't understand really well. Is it, for example, spread through tiny droplets, through big droplets, or does it just hang in the air? And there's variable and contradictory data on that. And so if you don't understand the background, then of course the information is going to be less reliable.
So if we don't know how big this pandemic will become, right now, the last I checked was we had something like 225,000 confirmed cases and about 5,000 deaths in America this morning. What if those numbers increase by a factor of 10? What happens then, and what is the best way for us to prepare for that so that we're safe and healthy?
We're focusing right now on trying to mitigate that so that we don't see that increase. The best thing we can do right now is social distancing and really good hand washing. And then as a country, we need to be much better about figuring out a way to get adequate supplies to the hospitals. That's protective equipment, ventilators, extra beds, extra spaces. And you're seeing now that hospitals are, based upon the executive order that came out 2 days ago, are going to be expanding into what was traditionally non-hospital areas. So you're going to see patients being cared for in maybe clinics, hotels, things like that. So we need to ramp up we need to do two things. We need to ramp up our capacity so we can take care of more patients, and then we need to decrease the rate of disease increases so that those two things can match. So we have enough resources to take care of the people who are going to get sick.
So it's not really a medical question, but what I'm hearing is that this is a black swan event that's really changing not only our economy and our health, but it could change society. You're talking about things to do with international supply chains. 9/11 changed American life. How will COVID change American life?
Well, I don't know if we can predict that. Or at least I can't predict that. I think fundamentally this will change American life, and I think it's going to be hard to know exactly how we're going to come out of that. But even things like, I have young children at home, distance learning. Nobody would have ever really thought that that's going to be something you can do for young kids, and now yet we're doing it. and parts of it will work and parts of it won't work. And I'm sure that will change learning going forward. Same thing for college students. Transportation has been decimated by this because people aren't traveling. And I'm thankful they're not traveling. But at some point, we're going to need to travel, and how that's going to happen and what people's reactions to that are going to be. Your business, other businesses, how are those going to be affected, and how are they going to try to adjust to meet, what might be new demands, yet old demands are no longer there. I mean, you see that while many companies are laying people off, transportation companies, big box stores, Amazon are hiring people because that's where people are shopping now.
But Charles Darwin had a quote, something along the line that it's not the smartest or the strongest that survive. The species that survive are those that are the most adaptable to change. So this will end. What are the type of adaptations that you think are necessary right now?
In terms of the health?
Yeah, but changing our behavior beyond just social distancing, which is, I guess the follow-on question there is, how long can we maintain social distancing? Because a lot of people are going nuts with their kids at home. But beyond that, what do we do?
I really think right now what we need to focus on is the social distancing and making sure that remains something that's feasible in terms of we have to be able to have food and, we have to be able to get health care, and then people have to do what they can do to keep themselves healthy and not to spread this around. Even if they have it asymptomatically, if they spread it around, they're making it worse for their community. And that's really got to be our major focus right now.
So we just got a question from Dr. David Fogel, who's an advisor to our company. How much should we be worried about what's happening in, say, we're in California, and early indications we've flattened the curve at least a little bit. When we see things happening in New York and Florida and so forth, where things are going to get bad, how much should we be worried about how much does the other states' actions impact us here?
Well, certainly there's a limited supply of resources in the entire country. And so, the more resources that are used in other places, the fewer resources there'll be wherever you may live. That said, all the communities and all the hospitals are actively working at trying to get involved with this, and we're slowly ramping up production. The industrial production, the longer that we can delay that peak in a particular area, the more likely that area will be able to manage that peak.
So we talk about the doubling period for the number of days for the disease to double. What's the doubling period for the medical infrastructure to keep up? Is that presumably it's a lot longer?
I don't know the answer to that question. And what you're seeing though is you're seeing pretty serious efforts to increase capacity. You're seeing, the two Navy ships, one in New York, one in Los Angeles. You're seeing field hospitals being built. You're seeing hospital systems and individual hospitals setting up tents to take care of patients outside their hospital, setting up clinics. There's going to be movement towards ambulatory surgery centers. So pretty much all elective surgery has been canceled in the United States. So the things that ambulatory surgery centers typically do, like maybe a colonoscopy, a minor surgery, those have all stopped. And so they have a bunch of healthcare equipment. They have some healthcare personnel. And so I think you're going to see, in fact, I know you're going to see patients being taken care of in those places. So hospitals will be moving patients from inside the hospital to those type of areas, and then maybe perhaps to hotels, so that we can reserve the hospitals for the sickest of the sick patients who can't be taken care of anywhere else. So we'll find other places to take care of people who can't be safely taken care of at home and need some care, but don't necessarily need to be at the highest level of care in a hospital or an intensive care unit.
How do we maintain our discipline around staying at home, social distancing? Because back to that fatigue question, boy, my 8-year-old niece who stays with, she's sick of it. She's like, oh, let's go play. And from an 8-year-old perspective, I get it. But from my perspective, how disciplined do I need to keep my family to keep them safe?
I think that, for children, it's very hard for them to understand this. And even for young adults, sometimes it's hard for them to see this because they've heard that they're not likely to get that sick. So knock on wood, unfortunately, very few children under the age of 20 have died from this worldwide. But children don't even understand that to begin with. I think as adults and as parents, we need to recognize that this is devastating already to many communities, not just economically, but health-wise. And, if you go look at some of the news reports and some of the videos out of, say, Italy or even New York City right now, that should strike enough concern and fear into your heart that you'll say, I'm going to do what I need to do to prevent this from happening to my community, my family.
Got it. Well, you and I have known each other a long time, and we've spent a lot of time on the side of mountains when we were younger and rock climbing, and recently we took a ski trip together. I want to help you. And I think a lot of our audience, or a lot of our members of the team think, what can we do to help? I'm not a doctor. I'm just a regular Joe. What can we do to help?
Well, I mean, the first thing is the hospitals are still short of PPE, personal protective equipment, in many communities. So if you have that, it'd be good to donate that to your local hospital or your local clinic, because they're still looking for that stuff. Already, the standard is that prior to this crisis, we would wear a mask and then we would take it off and throw it away right after we left the patient room. That's clearly the safest way to deal with these things. And already we're using them for the entire day, and then in many cases saving them and using them either the next day or a day or two later, and we rotated 1 or 2 masks. Just depends how severe that shortage is. And it's important that we have healthcare workers who don't get sick so they can be there and take care of their patients, and also that they don't spread it to other people, because we're still seeing patients in the emergency department who don't have COVID. And so we don't want to get them sick.
Yeah, and I've seen you in a lot of stressful situations, and you're always cool as a cucumber, always really. And I'm seeing the doctors on the news in New York not be so cool. Have you seen this before? I mean, ER doctors tend to be the most stable people you know.
Yeah, I mean, I've never seen this level of concern and fear among my colleagues nationwide. I mean, we're the doctors who, we're trained and we're used to. We don't like doing it, but we're trained and used to taking care of, 2 people with gunshot wounds and somebody else with a heart attack all coming at the same time. And that may happen in some smaller hospitals where you're the only doctor working. And sure, we get stressed, but we know how to work through that. This is quite different. We feel personally at risk. We feel our patients are at risk, and we feel that we're under-resourced. And so it's a huge concern among emergency physicians all across the country.
So the lesson from today is social distancing is the number one thing we can do. Is that correct?
Well, I think so. But I mean, I think also, we, like you said, it's going to be difficult to maintain that. So you have to, at the same time, go outside, go for a walk. Don't stay cooped up. But if you're outside for a walk, you stay 6 feet away from other people. You don't touch a lot of objects. You don't touch your face. We're going to have to continue making sure that the economy works well enough so that at least we can resupply the hospitals, resupply, other institutions that are providing necessary care. We still need to have police officers. We still need to have fire departments.
Absolutely.
And so any assistance in that area is really helpful. It's not going to be helpful if people just give up and drop out and say this is all over, because we will get through this. As a country, we are going to get through this. The idea is to get through this with the least amount of harm.
And how long will it go on for? When do you think we're going to get through this? Or how long do we have to maintain social distancing, for example?
It's really difficult, I think, at this point to predict how long total this is going to go on. What I can say is that I don't think we're getting a vaccine anytime soon. I mean, the fastest a vaccine could likely, lightning speed be done is a year to 2 years, probably longer. So I don't think a vaccine is going to save us. Hopefully, we'll find some treatments that are effective and useful, and that might change the course of this. Right now in California, there's going to be a shelter-in-place order till at least the beginning of May. Probably will go on longer than that. Mm-hmm. And, the prediction is there's a pretty interesting data set coming out of Washington. You can look it up. It's covid19.healthdata.org. So COVID-19, all one word, .healthdata, all one word, .org. And what they're predicting is that even if you get through this kind of initial rush, May and June, and people stay socially distancing, stay at home, and we kind of flatten that curve as best we can, that at the end of that period of time, 95% or more of the population will not have been exposed to this virus and will not be immune to it. And so that's going to create the potential for secondary or tertiary waves where you're going to see other outbreaks. Hopefully by that point, we'll have testing ramped up. We can do good monitoring, isolate, and hopefully we can come to a different strategy than what we have right now. Right now, the socially distancing is the best thing we have. Hopefully we can get back to a point where we could do really good traditional public health maneuvers and test people and isolate people who are potentially infectious.
Wow. Well, so we're all going to get through it. Is there anything else you'd like to share with us before we wrap up today?
No, I appreciate all the support that we've heard. The medical workers are definitely hearing this, that we're hearing support from non-medical people. And so we really do appreciate that. And then more importantly, we appreciate people staying home to stay safe. Thank you.
We are so grateful to the service you're doing. Really, you are a hero. So thank you, Tom, for everything you're doing. And please, everybody that's listening to this, let's follow the doctor's advice and shelter in place, minimize our exposure.
Thank you, Olin.
Okay.
Everybody stay
Thanks
healthy.
Again. Okay. Bye-bye.
Bye. You still there?